Patrick, I know you've just returned from the European Symposium. You have shirt that is as proof of your attendance there. I want to get into it a little bit, but let's just kind of high level overview. What was it like being back in person at an OHDSI event, and just kind of what did you think of the conference?
Yeah, it was so exciting to finally be in person with the community after a couple of years of trying to do the best we could virtually. The Erasmus team, Peter Reinbeck, did a wonderful job hosting us all on the SS Rotterdam. We had 300 folks all coming together from all around the world, sharing the work that they're doing. The first part was just really having that strong sense of community and togetherness. Lots of time to spend together, learning what we're doing, but also forging those relationships and those collaborations of moving the community forward. Definitely, I came away from the week with a lot of inspiration, a lot of excitement about where we're going.
Specifically, I thought a really interesting part of that first day was, well named the cruise around the European community, getting representatives from 10 different European countries highlighting what's going on, OHDSI or OMOP related. What did you take from that section in particular?
Yeah, that was a really exciting panel to have a cruise around Europe. We heard presentations from Estonia, Finland, Denmark, Norway, Germany, Italy, Greece, Ukraine, Israel, France, and each one of those represented tremendous progress within their countries, transforming data into the OMOP Common Data Model and starting to generate evidence. It was particularly exciting because what you really had a sense of togetherness within the national nodes, as well as an eagerness to try to collaborate on an international stage. And what was particularly exciting is many of these data resources have really been underutilized in this space of real world evidence. So it was exciting to see folks coming together from areas that have been typically less represented in global research and for regulatory decision making, really trying to showcase their populations and provide access to data in a way that we haven't had before. Also, just to see the remarkable progress that's been made in a relatively short time. It's a testament to the work of Eden, as well as the broader OHDSI community to support each other to make these tremendous strides around the world.
Similar to the Global Symposium coming up in October, you had 3 days of activities in the Netherlands. I know day 2 and day 3 were about workshops and work group meetings. So can you highlight anything about those 2 days?
Yeah, on the Saturday we had a workshop specifically on how to run a OHDSI network study to do characterization. And this was modeled and inspired by the work that Erica Voss has been leading within our vaccine evidence work group, centered on characterizing the adverse event background rate in COVID-infected population. And whereas Erica presented the scientific findings of her study on the main day, we had an entire day to basically show exactly how to conduct that work, hoping to provide inspiration for those in the community to think about conducting their own network studies. And what was exciting about there was we had over 100 participants who actively are engaged in using their OMOP Common Data Model, using OHDSI tools, but we're learning about how to actually collaborate together. And so it was a great time to share some of the practical tools and tips that we've learned along the way, and to inspire the next generation of OHDSI network studies to come about. Alongside that, there were a bunch of work group activities, including focusing on ETL and CDM, focusing on the Hades open source tools, patient level prediction, a session on OMOP FHIR and the vocabularies. And what I saw happening throughout there was people really coming together to think about how we can collaborate together on very specific problems and move forward. It was great to have a mixture of newcomers to the community or those that have been less active in the work groups, really meaningfully engaging and thinking about how they can move together to advance the work group activity. So it was really exciting to see all those collaborations take place.
It was nice to see at the end of June all this discussion and work towards global collaboration. The beginning of the month, there was, I thought, a really important partnership announcement that can really enhance global research, and that was the partnership between SNOMED and OHDSI and what that can do for research over the next 5 years. Can you discuss that a little bit?
Yeah, I think it's a very important partnership, and it's great that it is now formalized between SNOMED International and the Odyssey Central Coordinating Center. As most listening to this know, SNOMED is a backbone of one of our vocabularies, and represents a large part of our standards that we use for representing various domains, particularly representing medical conditions. And one of the challenges with using vocabularies is making sure that there is appropriate and fair use for everybody in the community. And so, quoting from SNOMED's press release, through this collaboration, SNOMED CT will be available to all Odyssey users for use in its products. And additionally, SNOMED International will work with Odyssey to provide SNOMED CT development licenses to users in non-member countries. And this is a really big deal as we think about how to make sure that Odyssey maintains its global presence and provides open and equitable access to anybody who wants to participate in Odyssey research. And it's great to have SNOMED on board, as they've been informally supporting us for many years, to now have a formal recognition that this partnership is going to continue to move forward to advance the use of SNOMED standards in all of Odyssey's activities.
Accomplishing this global research. Fortunately, the Odyssey community also has a number of open source tools that have been developed by the community, for the community, and 4 of them were highlighted in our a 10-minute tutorial session that we held during the month. 4 really useful tools that can be that can really enhance global research. Those 4 tools, can you just kind of discuss them and kind of what you learned from those tutorials?
Yeah, I was really appreciative of Joel Swerdell, Tiffany Callahan, Jenna Reps, and Martin Lavalle for presenting their 10-minute tutorials and giving everybody in the community a quick glimpse into 4 really important tools. Joel presented on Phevaluator, which is a tool for doing phenotype evaluation. Basically, it allows for developing a probabilistic model to quantify measurement error of a cohort definition. So estimating sensitivity, specificity, and positive predictive value. And this is a tool that's been extremely helpful in many studies. And as we as a community focus on measurement error, I think it's going to become an even more important tool. So it's great to have Joel showcase exactly how it works. Tiffany presented on Phenolator, which is a very large knowledge graph that she's created an automated system to curate and maintain. And Phenolator really provides a rich source of evidence to think about how to connect the dots between various medical conditions and drugs and procedures. And I think it's going to be a valuable supplement that we can integrate with all of our research. Jenna showcased the latest developments with the patient level prediction package, which is our core tool that we use to apply advanced machine learning algorithms to identify amongst a target cohort which patients are going to go on to experience some outcome in some time horizon. And Jenna actually was daring enough to actually do a live demonstration in 10 minutes or less to actually train a model and show the outputs. And really is a demonstration of tremendous advances in that tool. So thank the team for that. And then Martin presented CAP-R, which is a really interesting new development interface that allows R programmers to be able to write in a defined syntax to create cohorts. And so for those in the community who've been using Atlas as a way to build cohorts, now there's a programmatic approach to do it in R. And Martin's really been pioneering exactly how that's valuable. And what I heard from the community was that it was great to get this short exposure to these tools, because now it gives everybody the inspiration to go back, learn these tools in greater depth, and integrate them into their research. So I was really excited to have this session, and I really thank all of the speakers for taking the effort to provide those tutorials to our community.
And now as the calendar turns to the second half of 2022, we can really look forward to the symposium in October. I know we had a record number of brief reports come in for the collaborator showcase. I know the scientific committee, review committee will be looking at those. We have some great community calls planned for July. So certainly a lot to look forward to coming up this month and the rest of the year in Odyssey. Thanks for joining, Patrick.
Thanks, Greg. Science!